Ladies and gentlemen, sudden loss of hair in the form of alopecia areata is too traumatizing both for the patients, children and their families. To talk on pediatric alopecia areata and recent advances in its management, we have among us a young, energetic and dynamic pediatric dermatologist who has come all the way from Multan. She is Senior Registrar Pediatric Dermatology at Children's Hospital Multan. So she is the only pediatric dermatologist among us. Please welcome Dr. Amna Iqbal.
Bismillahirrahmanirrahim, worthy seniors and respectable colleagues, Assalamu alaikum and a very good evening. First of all, I would like to congratulate Professor Dr. Harun Nabi, Professor Dr. Faria for organizing this symposium. This was the need of the time. And secondly, I'm extremely grateful for providing me this opportunity to talk here. I feel humbled and honored. The topic allocated to me today is emerging modalities in the treatment of alopecia areata in pediatric population. Alopecia areata, owing to its autoimmune and non-scarring nature, has a global prevalence of about 2%. It's the third most common dermatological presentation in pediatric population. Most people of the patients develop alopecia areata before the age of 40 years, and the peak onset is between 2 to 6 years of age. Clinically, the classical three patterns, alopecia totalis involving the whole of the scalp, universalis involving the whole of the body, and alopecia areata in its patchy form. Other special variants are alopecia areata reticularis, perinevoid alopecia areata, in which there is a patch of loss of hair around a pigmented nevus. Ophiasis, in which a band of hair is lost in the occipital region, and an opposite to ophiasis, where the only left part of hair is the band of hair in the occipital region. It's a very devastating disease, but its course is more severe and less responsive to treatment, especially in female gender, if there is association with allergic disease, especially atopy, or the age of onset is before the age of 16 years, or it is associated with other concomitant autoimmune disease, for example, the SLE or autoimmune thyroid disease. While evaluating the severity of alopecia areata and while assessing the efficacy of the treatment, the most commonly used tool is the SALT, that is severity of alopecia areata tool, in which the scalp is divided into 4 different quadrants, and each quadrant is further divided into 4 different, keeping the left side and right side 18% each, the top, the crown is 40% and the back is 24%. While treating alopecia areata, there is no size that fits all. So we have to customize and tailor our treatment. The factor that we must consider before starting a treatment to a pediatric population of alopecia areata, we must take into account the age of the disease, the extent of hair loss, duration of treatment, the psychological impact on the child and their family. Moreover, what is the level of desire of the patient and family, and how efficaciously they can tolerate the side effects of the treatment. Going to the treatment, we have the old, tried, tested and conventional treatments that involves topical, intralesional and systemic steroids, topical irritants, topical immune therapy, and among immune suppressants, methotrexate, azathioprine and cyclosporin. The new modalities, our focus will be on JAK inhibitors and minoxidil 7 years, and the dose was given 15 mg per day, and after 3 months the SALT score was 9. Abrocitinib is under clinical trials. both for in alopecia areata, both for in adults and in pediatric population. JAK inhibitor adverse effect has already been explained by Professor Dr. Lamis, so I am skipping that. Pre-treatment screening includes the complete blood count, creatinine, hepatic function test, fasting lipid profile, tuberculosis screening, and HIV screening. JAK inhibitors are largely safe and highly effective for adults with severe alopecia areata, but RCTs in children with alopecia areata needed to establish efficacy. Next is minoxidil, that is available in both oral and topical forms. It is not effective as an individual therapy, but may enhance the response to systemic JAK inhibitors. There are multiple studies in which the oral minoxidil was used in combination with other treatment modalities. Next in pipeline is dupilumab. It is FDA approved for atopic dermatitis. It has shown promising results in treating the alopecia areata in pediatric population that had concomitant atopic dermatitis as well. If we conclude, alopecia areata in population occurs at higher rate and greater severity than adults. There is significant effect on the quality of life. There are several treatment options are available and even more are on the horizon. So there is so much reason to be hopeful because we can try a lot of new stuff and we can give hope and bring back the smile and confidence to the young innocent souls. Thank you so much.
टाइम बड़ा थोड़ा रह गया. अच्छा एक आई विल लाइक टू शेयर वन थिंग कि मेरे उधर क्लिनिक के साथ एक रूमेटोलॉजिस्ट भी हैं, तो उनका ये ख्याल है कनाडा में, तो उनका ये ख्याल है कि इन आवर पॉपुलेशन जैक इनहिबिटर्स में 2 टेस्ट मैंडेटरी होने चाहिए, और वो है एक ट्यूबरक्लोसिस के बारे में, क्योंकि रीएक्टिवेशन ऑफ ट्यूबरक्लोसिस, और इवन FDA ने भी ये वार्न किया है कि जैक इनहिबिटर्स एंड बायोलॉजिक्स, एक्सरे टेस्ट और एलेग्रा, तो हमने अपनी स्टडी जो कर रहे हैं उसमें ये 2 टेस्ट तो मैंडेटरी हैं कि रीएक्टिवेशन ऑफ ट्यूबरक्लोसिस के लिए, स्पेशली इन अवर पॉपुलेशन. और दूसरा, जैक इनहिबिटर्स में एक और प्रॉब्लम है जो जिस पे हमने बड़ी थोड़ी सी डिस्कशन की है, दैट इज़ मेस, एंड दैट इज़ मेजर कार्डियोवास्कुलर एक्सीडेंट्स. और ये जो है ना, स्पेशली जब आप यंग एडल्ट मेल्स को दे रहे हो तो उनमें थ्रोम्बोएम्बोलिक फिनोमिना काफ़ी वहाँ उसका सीरियस नोट लिया जा रहा है. आई हैड वन पेशेंट, तो उनको पहले मैं इसको बड़ा लाइटली लेता था, तो एक मेरा एलोपेशिया एरेटा का ही पेशेंट था, टोटेलिस, और बड़ा फिट हेल्दी और सारी इन्वेस्टिगेशन साथ साथ, तो उसमें बेरिसिटिनिब ले रहा था. तो वन फाइन मॉर्निंग ही सडनली कोलैप्स्ड, और किसी को कुछ समझ नहीं आया, और माइल्ड उसको CVA हुआ, और फिर उसके बाद उन्होंने सारी इन्वेस्टिगेशन की, कुछ समझ नहीं आया. तो लकीली उसके पास वो मेरी प्रिस्क्रिप्शन थी, उन्होंने डॉक्टर्स ने देखी, तो उन्होंने कहा ये इट मे बी ए कॉज. फिर उन्होंने मुझे कॉल किया कि आपका क्या ख्याल है कि ये बेरिसिटिनिब ले रहा है, तो इससे इसको ये प्रॉब्लम हो सकता है, क्योंकि ये नई ड्रग है ना, अभी इनको पाकिस्तान में नहीं है, लेकिन बाहर अमेरिका FDA और कनाडा बोथ मेजर कार्डियोवास्कुलर एक्सीडेंट्स के लिए पेशेंट से रिटन कंसेंट 2 चीज़ों का लेते हैं. मेल्स में CVA और कार्डियोवास्कुलर एक्सीडेंट्स, और एशियन पॉपुलेशन में रीएक्टिवेशन ऑफ ट्यूबरक्लोसिस का. तो ये हमें चूँकि नई दवाई है, तो मैंने कहा कि हमें इसका ज़रा शेयर करना चाहिए.